You woke up this morning and reached for water before anything else. Your mouth felt like sandpaper, your throat scratchy and uncomfortable. Maybe you thought it was normal, just part of getting older, something everyone deals with after 55 without thinking twice about it. But researchers at major medical institutions discovered this nightly dryness might be signaling something your doctor never explained to you. For decades, we've been told that dry mouth at night is simply what happens when you age, an inevitable part of getting older that you should accept. Most people believe their salivary glands just stop working properly after a certain age, and there's absolutely nothing anyone can do about it. This belief has been repeated so many times that almost nobody questions it anymore. They just accept the discomfort as their new normal reality. But recent studies on aging and oral health revealed this common belief might be keeping millions of people from addressing a fixable problem entirely. Researchers studying older adults discovered that chronic dry mouth is not primarily caused by aging itself, but by something far more specific. What they found surprised even experienced doctors who had been treating patients for decades without connecting these particular dots before now. If you want to understand exactly what's happening in your mouth every night and how to protect your health starting today, stay with me. Tell me in the comments where you're watching from. I love knowing people from so many different places are taking care of their health together. Think about your nighttime routine for a moment. You brush your teeth, maybe read a little, turn off the light, and drift into sleep naturally. But while you're sleeping peacefully, something shifts inside your mouth that you never feel happening, a change that affects every single person. Your body follows an internal clock, and that clock tells your salivary glands to slow down production dramatically during nighttime hours consistently. This is completely normal, and happens to everyone, young and old alike. It's part of how your body conserves energy while you're resting overnight. But for many people over 55, this natural nighttime dip combines with other factors that turn mild dryness into a real health concern. The difference between waking up slightly thirsty and waking up with a mouth so dry it hurts comes down to specific causes layering together. And now we're going to explore the 7 real causes of dry mouth at night that doctors rarely take the time to explain in detail. Pay close attention, because understanding these causes is the first step towards sleeping more comfortably and protecting your oral health for years. Cause number 1, the circadian dip in saliva production. Your body operates on a 24-hour internal clock called the circadian rhythm. This rhythm controls everything from your energy levels to your hunger, and it also controls how much saliva your glands produce throughout the day. During the daytime, your salivary glands stay active, producing enough fluid to keep your mouth moist, help you chew and protect your teeth naturally. But when nighttime arrives and you fall asleep, your body shifts into rest mode, and saliva production drops to its lowest point of the entire day. This happens to absolutely everyone. It's not a sign of illness or aging. It's simply how the human body is designed to function during sleep. The problem is that this natural dip creates a foundation that makes every other cause of dry mouth much more powerful and much more noticeable. Think of it like this. If your mouth is already producing less moisture at night, anything else that reduces saliva becomes twice as impactful. Studies on circadian biology show that salivary flow can drop by more than half during sleep compared to waking hours in healthy adults overall. This baseline reduction is why you might wake up slightly thirsty, even on a perfectly normal night when nothing else is going wrong with your health. But when you combine this natural dip with the other 6 causes we're about to discuss, that mild dryness can turn into serious discomfort. Understanding this circadian pattern helps you see why nighttime specifically is when dry mouth becomes most severe for so many people over 55. It's not that your mouth suddenly breaks down at night, it's that nighttime is when your body's natural moisture production is already at its weakest. So if you've ever wondered why your mouth feels fine during the day but terrible by morning, this circadian dip is the underlying reason. Now that you understand this foundation, the next 6 causes will make much more sense, because they all build on top of this natural nighttime reduction. Keep this baseline in mind as we move forward, because recognizing it helps you understand why addressing the other causes makes such a big difference. Cause number 2, mouth breathing during sleep. Breathing through your mouth overnight is one of the leading reasons people wake up with a dry throat. When you breathe through your nose, the air passes through tissues that naturally humidify it before it reaches your throat and lungs below. But when you breathe through your mouth, especially for hours at a time, dry air flows directly across your tongue, gums, and the roof of your mouth. This constant airflow causes the thin layer of saliva coating your mouth to evaporate much faster than it would if your mouth stayed closed. Many people breathe through their mouths at night without even realizing it, often because of nasal congestion, allergies, or simply long-standing habit patterns. If you wake up with a dry mouth and also notice your throat feels scratchy or irritated, mouth breathing is very likely part of the problem. Partners often notice this first. They might mention that you sleep with your mouth open or that you snore, both signs of mouth breathing overnight. Seasonal allergies can make this worse, as blocked nasal passages force you to breathe through your mouth, even if that's not your usual pattern. Over time, chronic mouth breathing doesn't just dry out your mouth, it can also increase your risk of cavities and gum problems because saliva protects teeth. Saliva contains natural antibacterial substances that help control the bacteria in your mouth. So when it evaporates, those bacteria multiply more easily during sleep. The solution starts with identifying why you're breathing through your mouth in the first place, whether it's congestion, a deviated septum, or something else. Using a saline nasal rinse before bed can help clear your nasal passages and make it easier to breathe through your nose throughout the night. Some people find that sleeping on their side instead of their back helps keep their mouth closed and reduces mouth breathing significantly over time. If nasal congestion is chronic and doesn't improve with simple measures, it's worth talking to a doctor about underlying causes like allergies or structural issues. Addressing mouth breathing can make a dramatic difference in how your mouth feels in the morning, often within just a few nights of making changes. Cause number 3, dehydration throughout the day. Your body needs water to produce saliva, and if you're not drinking enough during the day, the deficit shows up. Many people over 55 drink less water than they should, sometimes because they don't feel as thirsty, sometimes because they worry about nighttime bathroom trips. But when you're chronically underhydrated, your salivary glands simply don't have enough fluid to work with, especially during the long hours without drinking at night. Think of your body like a well. If you don't refill the well during the day, there's not enough water to draw from when your body needs it overnight. Dehydration doesn't just affect your mouth, it can also make you feel tired, cause headaches, and even contribute to constipation and other digestive issues. The problem is that by the time you feel thirsty, your body is already mildly dehydrated, so thirst isn't always a reliable signal to drink more water. Coffee, tea, and alcohol all have mild diuretic effects, meaning they can increase urine output and contribute to dehydration if you're not balancing them with water. A simple way to check your hydration is to look at the color of your urine. Pale yellow means you're well hydrated, while dark yellow suggests you need more fluids. Drinking water consistently throughout the day is far more effective than trying to drink a lot right before bed, which often just leads to nighttime bathroom visits. Aim for small amounts of water regularly, sipping throughout the day, rather than gulping large amounts at once, which your body absorbs and uses more efficiently. If plain water feels boring, try adding a slice of lemon or cucumber for flavor, or drink herbal teas that don't contain caffeine to stay hydrated. Eating water-rich foods like cucumbers, melons, oranges, and soups also contributes to your daily fluid intake and helps keep your body well hydrated naturally. If you're taking medications that make you urinate more often, like diuretics for blood pressure, you need to be even more intentional about drinking enough water. Proper hydration won't solve every case of dry mouth, but it's one of the easiest and most foundational steps you can take starting today. Cause number 4, aging's effect on salivary glands. There's a common belief that salivary glands simply stop working properly as you get older, but the truth is more nuanced. A major review published in 2021 on aging and salivary glands found that resting saliva flow does drop, about 44% in older participants. However, stimulated saliva flow, the kind produced when you're eating or chewing, drops far less, meaning the glands still function but respond more weakly at rest. This distinction is important because it shows that your salivary glands don't just shut down with age, they become less active when they're not being stimulated. During sleep, when there's no eating, drinking, or talking to stimulate saliva production, this age-related reduction in resting flow becomes much more noticeable overnight. The glands themselves don't shrink dramatically or stop working entirely, but the signals that tell them to produce saliva become weaker over time with aging. This means that older adults naturally produce less baseline moisture in their mouths, especially during the long hours of sleep when no stimulation is happening. But here's the key point. This age-related decline is relatively modest and doesn't fully explain severe dry mouth that disrupts sleep and causes daily discomfort. If you're waking up every single morning with a mouth so dry it hurts, aging alone is not the culprit, something else is layering on top of it. The good news is that because stimulated flow remains relatively strong, simple actions like chewing sugar-free gum can help boost saliva production during the day. Drinking water with meals, eating foods that require chewing, and staying active all help stimulate your salivary glands and keep them working as well as possible. Some people find that their mouths feel drier after dental work or tooth loss because chewing becomes more difficult and less frequent, reducing natural stimulation. Maintaining good oral health and keeping your teeth in good condition helps you continue chewing effectively, which in turn keeps your salivary glands more active. Aging contributes to dry mouth, but it's not a life sentence, and it's not the primary driver of severe symptoms in most people over 55. Cause number 5, medications And this is the most important cause of all, the one doctors rarely explain clearly, even though it affects millions of people. More than 1/3 of older adults use 5 or more prescription medications at the same time, a pattern called polypharmacy that's extremely common after 55. And here's the critical fact. Several major classes of medications have the capacity to cause dry mouth by interfering with the nerve signals that tell salivary glands to produce fluid. These include medications for high blood pressure, also called antihypertensives, which millions of older adults take every single day to control their cardiovascular health safely. They also include anti-ulcer medications, the kind used to treat heartburn and acid reflux, which are among the most commonly prescribed drugs in the world today. Anticholinergic medications, which block certain nerve signals, are used for conditions like overactive bladder, allergies, and even some types of depression and anxiety disorders. Antidepressants, particularly older classes like tricyclics, are well known for causing dry mouth as a side effect, though newer ones can cause it too in some people. The mechanism is specific and understandable. These drugs interfere with the chemical signals that tell your salivary glands to release fluid into your mouth throughout the day. When you take one of these medications, the effect on saliva production might be mild, noticeable but not severe, something you can manage with extra water. But when you take 2, 3, or more of these medications together, the effects compound, and that's when dry mouth becomes a serious nightly problem for many. A study on older adults found that patients over 71 years old with polypharmacy had nearly 9.68 times higher odds of being diagnosed with dry mouth. This is not a small effect, it's a massive increase in risk, and it's directly tied to the number of medications interfering with salivary gland function simultaneously. The tragedy is that most people are never told this when they're prescribed these medications, so they suffer with dry mouth thinking it's just aging. They try drinking more water, using mouthwash and other remedies, but nothing works because the root cause is the medication blocking the glands from producing saliva properly. Cause number 6. Sleep apnea, an underdiagnosed condition that has a direct and powerful connection to waking up with a dry mouth every single morning. Sleep apnea happens when the upper airway becomes partially or fully blocked during sleep, interrupting breathing repeatedly throughout the night without you realizing it. When your airway closes, your body compensates by trying to breathe harder, and often this means breathing through your mouth instead of your nose naturally. This bypasses the nose's natural humidifying function, so dry air flows directly into your mouth and throat, causing saliva to evaporate rapidly and leaving tissues dry. By morning, your mouth feels like sandpaper, your throat is scratchy and sore, and you might even have a headache from poor oxygen levels during the night. Many people with sleep apnea don't know they have it because the breathing interruptions happen while they're asleep and don't fully wake them up consciously. But there are signs you can watch for: loud snoring, gasping or choking sounds during sleep, and feeling exhausted even after a full night in bed. If you wake up with a dry mouth every single morning, combined with snoring or daytime fatigue, these are strong signals that sleep apnea might be the hidden cause. Sleep apnea is more common in people over 55, especially in those who are overweight, have high blood pressure, or have a thicker neck circumference overall. Left untreated, sleep apnea doesn't just cause dry mouth, it increases the risk of heart disease, stroke, and high blood pressure because of the strain on your cardiovascular system. The good news is that sleep apnea is treatable, and treatment often resolves the dry mouth problem almost immediately because it restores normal nasal breathing overnight. The most common treatment is a CPAP machine, which keeps your airway open with gentle air pressure, allowing you to breathe through your nose throughout the night. Some people also benefit from oral appliances that reposition the jaw, or from lifestyle changes like losing weight and sleeping on their side instead of their back. If you suspect sleep apnea, talk to your doctor about a sleep study, which can diagnose the condition and determine the best treatment approach for your situation. Cause number 7. Autoimmune conditions and hormonal factors, the invisible causes that often go undiagnosed for years before someone connects the dots finally. Dry mouth during nighttime is especially common in postmenopausal women because hormonal changes after menopause can affect moisture production throughout the entire body. Estrogen plays a role in keeping tissues moist, including the tissues in your mouth. So when estrogen levels drop, many women notice their mouths feel drier. But there's another cause that's even more serious and often missed: Sjogren's syndrome, an autoimmune condition that specifically attacks moisture-producing glands in the body. People with Sjogren's syndrome experience severe, persistent dry mouth and dry eyes because their immune system mistakenly attacks the glands that produce saliva and tears. This condition is more common in women and often develops in midlife, but it's frequently undiagnosed because the symptoms are mistaken for normal aging or side effects. If your dry mouth is severe, happens every single night, and is accompanied by dry eyes, joint pain, or fatigue, Sjogren's syndrome should be considered as a possibility. Other autoimmune conditions like rheumatoid arthritis, lupus, and diabetes can also contribute to dry mouth because they affect how the body regulates fluid and gland function. Diabetes in particular can cause dry mouth because high blood sugar levels lead to increased urination, which depletes the body's fluid reserves and reduces saliva production. Hormonal conditions like thyroid disorders can also affect saliva production because thyroid hormones help regulate metabolism and fluid balance throughout the entire body. If you have any chronic health condition and you're experiencing persistent dry mouth, it's worth discussing with your doctor whether the condition itself could be contributing. Blood tests can help identify autoimmune conditions like Sjogren's syndrome, and early diagnosis allows for better management of symptoms and prevention of complications over time. The key message here is that chronic severe dry mouth is not something to ignore or accept as inevitable. It can be a signal of an underlying condition. If simple measures like drinking more water and using a humidifier don't help, and especially if you have other unexplained symptoms, seek medical evaluation promptly. But before you start making changes based on what you've learned, there's one critical mistake you need to avoid, something that could actually make the problem worse. Many people think the solution to dry mouth is drinking a lot of water right before bed, filling up a big glass and finishing it just before lying down. The problem is that drinking large amounts of water right before sleep often leads to waking up multiple times during the night to use the bathroom instead. This disrupts your sleep quality, and ironically, poor sleep can make you feel more tired and less motivated to stay hydrated properly during the day overall. Here's a simple plan you can start using tonight to reduce dry mouth and protect your oral health without making drastic changes to your life all at once. First, focus on hydrating consistently throughout the day, sipping water regularly from morning until early evening rather than drinking large amounts right before bed. Second, use a bedroom humidifier to add moisture to the air, which helps keep your mouth and throat from drying out as much during the night. Third, avoid alcohol and caffeine in the evening hours, as both can contribute to dehydration and make dry mouth worse by the time you wake up. If this video helped you understand what's really happening in your mouth at night, leave a like and share it with someone you care about. You'll see 2 videos on the screen now, and I'm sure you'll want to keep learning how to take care of your health with us. You'll see 2 videos on the screen now, and I'm sure you'll want to keep learning how to take care of your health with us.